I want to bring into our conversation now two guests, Dr. Philip Ozuah, who is president and CEO of Montefiore Medicine in New York City. New York, of course, one of the original hotspots for coronavirus. And we're also joined by Dr. Susan Bailey. And Dr. Bailey is the new president of the American Medical Association, and that is a group that advocates for physicians across the country. Welcome to you both. I'm going to make a slight adjustment to my camera to clear things up. Oh, we're seeing the fourth wall broken a lot these days. Welcome to you both. And I want to put the question to you first, Dr. Ozuah, this running on fumes question. You know, you ran a system that was caught very, very much in the crux of this crisis through March, April, May. I know that it's not over, but if somebody in your position running a hospital system, say, or medical system, calls you now from say Arizona, or calls you now from Texas, is there anything that you could share with that individual based on what you've learned by having gone through all of this ahead of everyone else?
Thank you very much, John. There are many things that we can share, and actually, interestingly, I'll be speaking with 5 hospital systems in Texas with the CEOs and their teams around sharing some of the experiences that we have. The answer is that yes, you do have staff that are running on fumes for a multitude of reasons. One is the surge in patients, the overwhelming surge in patients. We tripled our ICU beds, so intensive care capacity. And then what you don't fully appreciate is the number of staff who go out sick in the midst of this. So you're surging in patients without surging in staff. On the contrary, there's a reduction in staff. And so anticipating all of those things, anticipating all the things that will go down, there's some specifics and there's some that are large. As I was saying to one of the CEOs in Texas, I said, you'll find that you will run out of respiratory technologists to run your ventilators. And he said, oh my, are you looking at my staffing sheet? Because I'm just about to. And so if you don't anticipate that and train others to be able to take over that function, you end up with very few people managing an overwhelming number of patients and not having any time off day after day after day, week after week. So yes, there are lots of lessons that can be shared.
Dr. Bailey, again, you represent physicians across the country. Are you seeing this burnout issue being discussed? And I want to put this in a little bit of context. I'm married to a primary care physician who, as I speak, is doing clinical, seeing patients clinically today. And what I find with her is that on the one hand, she's very tired. On the other hand, the sense of having a mission that brought her into this profession in the first place has never been higher. That, you know, this is the big time. This is I've never been more needed. And I'm wondering, Dr. Bailey, do you hear that sort of dual dynamic going on with the physicians that you're in touch with?
Well, first of all, thanks for having me, and thanks for letting me follow Anthony Fauci. That's just never been anything I've ever wanted to do, but because he's one of my heroes. But back to your very serious question. Burnout has been a problem amongst physicians and other healthcare workers for years. AMA has been studying this very closely and developing tools for physicians. And it was one of my personal priorities for my presidency. And then coronavirus changed everything, but in a way it really didn't, because burnout is a more important subject than ever. And yes, it does bring into focus why we went into medicine in the first place, which was to help others, to heal the sick, to do the very best we can. And but it reaches a certain point where you are running on fumes and not sure how much you have left to give. And then as was mentioned, there's the risk of becoming ill yourself and developing the coronavirus and being out sick. Another thing that has kind of complicated this mix, well, especially in Texas, which is where I am right now, is the fact that this all occurred. Our surge occurred around the 1st of July at the start of a new academic year, which is always a time of stress and challenge. I feel very comfortable about the quality of care people are getting, but it's just an extra burden on the system. And I think that we have to be extra aware of the special psychological as well as physical needs of our healthcare workforce to help get them through this.
Dr. Ozuah, in the Montefiore system, have you had fatalities among your staff as a result of infection by coronavirus?
Yes, John. Unfortunately, despite our best efforts, we lost 27.
27?
To after coronavirus. Yeah, horrendous.
I'm shocked at that number, and it makes me want to ask the colleagues of those individuals, where's the time just to do normal grieving and showing up for work the next day? I mean, how are you coping with that?
There was no time to grieve. I think even one loss of a colleague would have been too many. 27 was more than all of us could bear, and it's not simply losing a colleague, but it's also having seen many of our colleagues on ventilators, prone in the ICU for weeks. These are folks that you work with, and you see them in that state, struggling to breathe. And some colleagues we lost despite weeks and weeks and weeks of heroic efforts on the parts of other co-workers of ours, are trying to save them. So, we just, the demand on our people's time, John, was so extreme that there was no time to reflect. There was no time to grieve. There were so many people who needed our help. Now, the good news is that we saved, of the approximately 12,500 people that were admitted to Montefiore during this pandemic, 10,000 were saved and went home. And you have to realize that in New York, if you were moderately ill with coronavirus, you were home. So only the most severe of the sick were in the hospital. So and so it's been tough. We implemented a lot of support measures for our colleagues and ourselves. Hotlines, R&R options, hotel rooms, rental cars, everything that we could think of, free meals, free parking, free that change of clothing every day that we laundered, so people didn't have to worry about taking the virus home. But the toll was real, John.
Within the arena of the thing that we're talking about is the impact on your staff. Is there anything that you would have done differently, knowing what you know now, that in fact you could impart to people elsewhere in the country in your position?
In terms of the impact, well, I think if we had a crystal ball and could somehow have stockpiled PPE well beyond anything that we thought we could ever use in the next 5 years, that would have had an impact, because the worry and the anxiety about getting sick and the worry about inadequate supplies of PPE and the worry about having to reuse masks and so on, when heretofore we were using the one mask a patient, and we just couldn't. We went from consuming a handful of such masks a day to over 100,000 a day. So those were real, and that anxiety, if I could have had the foresight to stockpile millions of dollars of PPE that the organization had no use for. That would have helped. But what happened here was on March 11th, we had one patient in the hospital with coronavirus. By March 31st, we had 2,000. So it blew up so quickly and so fast that there was no time to ramp up staffing. There was nowhere that we could have gone to obtain additional staff. So the existing folks had to deal with all of this, and it was very, very challenging. But I must say I'm extremely proud of the way that our people rose up when this city shut down.
We just had a question come in asking why is medical staff dying? Is it the lack of PPP? And you've just answered that question. I want to bring in one more time Dr. Bailey. And Dr. Bailey, you know, we know that economically millions of people are having a difficult time, but that apparently is now beginning to include physicians, because there are specialists whose practices are being closed down and their appointments canceled, and elective surgeries are not happening. What impact are you seeing in the medical profession among people who are not directly in doing the work to respond to COVID-19, but are impacted by it?
Well, it's an interesting spectrum of physicians that are hospital-based, that are working harder than they've ever worked in their lives, and physicians that have either been shut down by their local authorities or elective procedures not being done, and they don't have any patients and are struggling to keep the doors open and keep their staff. AMA has been working with physicians on this, and it's really, really struck a blow to many physicians' practices out there. Fortunately, physicians have, in smaller practices, have been able to qualify for many of the distributions that have come out, the CARES Act, the Paycheck Protection Program. Physicians have been able to take advantage of that. But in addition to the fact that physicians' practices are struggling to keep the doors open, a pent-up demand of services that have not been done and needs that have not been met. And we're very concerned that even though the physicians' doors might be open, their patients are afraid to come in. And so they're not getting their mammograms, they're not getting their immunizations. Immunization rates have plummeted amongst children since this started. They're not following their hemoglobin A1Cs and keeping their blood pressure in check. And we're very concerned about the long-range implications that is going to have for the care of chronic health. And PPE, back to that, has been an issue in physician practices as well, and is still an issue. There are many practices that are having a hard time obtaining PPE because they have no supply chain. You know, we didn't have a source for masks in my practice. I had 10 N95 masks sitting in a closet left over from H1N1 10 years ago. And those were the only masks we had in a practice of 3 physicians.
Well, Dr. Bailey, I'm sorry, I apologize to interrupt. We're going to do a shift in topic now, but you've really, really laid out, I think, some of the things that we're going to be talking about through the rest of the summit here. I want to thank you, Dr. Bailey, so much for joining us from Texas, and thanks for making the time.